Across the Fence. I'm Keith Silva. Today we're talking about a Vermont that is vital to the state's economy and culture, but for many, it's out of sight and out of mind. The migrant crisis at the southern U.S. border is a nationwide problem, which means it's a Vermont problem. In the first 8 months of 2023, the Migrant Health Programs of the University of Vermont Extension have served 378 Spanish-speaking non-agricultural workers. 271 of those people arrived in Vermont within the past year. Of those 271, 86 are children. Beginning in 2010, UVM Extension began working with Vermont's migrant farm worker population, primarily in areas of accessing healthcare and social services. And as these increases indicate, the numbers and the need continues to grow. Our guest today is, as the saying goes, doing the work. Naomi Wolcott-McCausland leads UVM Extension's Migrant Health Programs. Thanks for talking with me today, Naomi.
Glad to be here.
How many migrant farm workers and families do you estimate live in Vermont?
So over the course of a year, we think about 900 or so Spanish-speaking agricultural workers, plus family members, as well as including spouses, are here primarily on dairy farms. And for 6 weeks to 10 months of a year, we see that Jamaican workers, along with a handful of folks from Latin America, are coming to work again seasonally on our farms.
Those are those H2A workers that people talk about, right? The seasonal Jamaicans come to work the apples or some of the other vegetable crops.
Correct. So those are coming here on a visa program.
The migrant crisis at the southern border is an issue that's far from new. As I said earlier, you've seen a steady increase in referrals since 2020. Where are these referrals coming from? How do you learn about that these people are here?
The majority of the referrals come actually from individuals who we've worked with in the past. So maybe the cousin of someone or the brother of someone, the sister-in-law. So most are from the communities we serve. We are seeing an increase in referrals from schools, from health entities, and from other community-based organizations that are identifying needs around health-related services that they're unable to meet. I would say that, what we're seeing is similar to what you indicated before, which is a significant increase in migrant workers who are coming and not within the agricultural community, a significant amount of children. So many are traveling with their families. And, you mentioned a migrant crisis, and I think on one hand, it's a crisis from a services perspective. Vermont doesn't have a formalized system to receive migrant workers and make sure that there's a range of supports from legal services to medical services to housing. But on the other hand, it's also an opportunity for Vermont. There's a lot of richness that comes with cultural diversity, with language, with culture, with food, differences that people bring in. And so I think it's an opportunity both from the cultural perspective and then significantly from an economic perspective, because they're filling jobs that otherwise would go unfilled and meeting a crisis that we're seeing in terms of labor shortage in Vermont.
Right. Yeah, we got to be careful, certainly with words. We've got a graph that indicates some of the increases that we're looking at. The first graph is Migrant Health Programs clients that you saw, and you can just see by this graph from the years there at the bottom that this is doubled since the first year, and it just increased. And what are those two different colors indicating, Naomi?
Sure. So in 2019, we were serving exclusively farm workers. I chose to include the year prior to COVID because COVID was just a strange time for most. So we served in an 8-month period just under 200 farm workers and family members. Jumping ahead to the last 8 months of 2022, we saw a significant increase in non-agricultural migrant workers. So that's that section in orange. And then in the first 8 months of 2023, that number continued to grow.
Naomi, you've also seen an increase in children. You said earlier that some of the referrals you get are from the schools. Why are you seeing an increase in children?
We're seeing an increase, I think, in two different areas. We are seeing more children joining their farm worker parents on the farm, or families who are connected to the farm worker community coming as whole families to the farms. But I would say the area where we're seeing the most increase in children is really with the non-agricultural migrants who, I think are really traveling with their kids because they are moving away from really challenging situations in their home countries, and they're looking for an opportunity to provide a better life for their entire family, and likely looking to settle here instead of what we've seen in the past, which is migrant farm workers still considering their home country to be where they'll end up. Sometimes in the case of seasonal workers, that's every year.
Right.
But in the case of dairy workers, they may be here for a few years, but ultimately are returning home to family.
Right.
In our case, primarily in Mexico.
Right. Migrating, literally migrating to Vermont, working for a couple of years, and then migrating back home, essentially.
Correct. And so the new arrivals, our sense, it's very new. We're seeing this significant increase in the past year, 2 years. So we don't know what that will look like for Vermont. But our sense is that when families are traveling as a unit, they are looking to be able to put down roots and stay.
Are we seeing these increases in rural areas, in farm, more agricultural-based areas, or are we seeing them in cities and towns as well?
I would say both. We are definitely seeing increases in areas that some people may associate more with different cultural groups, different language groups, places like Burlington, Winooski, but we are also seeing families that are moving to these smaller towns that historically haven't had many families that speak languages other than English in the past.
Where are the non-agricultural migrants working? I think you said a little bit earlier, you said building trades, but where else are they working?
You'll find them working really in any job that is facing, or industry that's facing a labor shortage, primarily jobs that require physical labor, sometimes that have odd shifts, that require long hours. So everything from construction, including roofing, to hospitality, food service, restaurants, cleaning, things like that.
Okay. I buried the lead a little bit. You recently received an award designation as a community star from the National Organization of the State Offices of Rural Health. Congratulations.
Thank you very much.
Rural Health Day is coming up on November 16th. What should people think about when they think about rural health and how it affects the migrant population, or migrants in general?
Sure. So I think rural health really it's an important area to put resources and put efforts, because the rurality of a state really impacts how people, where people can access care. There's less access to services because services are farther away, particularly with the populations we work with. Many of them don't have transportation. They don't have access to public bus services because it's outside of commuter routes. There's pretty limited public transportation. So I think it's really important to consider how rural life can impact everyone's health, including farm workers and non-migrant workers that face these additional barriers like language access, cost of care, work schedules, things like that.
We have a video from the Vermont Health Department that talks about community health workers, and we'll roll that video and we'll come back and quickly talk about that.
I, right now, am going to pick up one of my clients. She is 8 months pregnant, so she's right there. Healthcare access is a right for everyone and should be provided to everyone. She has a prenatal appointment. She needs to get an ultrasound done before she has her appointment tomorrow. Bien, ya vamos. restrict this idea of health to just a clinical medical term, then we're really missing the kind of influence it has on other aspects of people's lives.
You know, sometimes we are, at the farms doing vaccine clinics.
Connecting to social services like WIC and food stamps.
We also work with organizations that provide food.
Creating educational health programming, creating support groups for individuals.
This role matters because this is having someone that's able to be out there navigating and being willing to go the extra mile.
We do serve as an advocate for these people because we're able to tell their story for them,
These individuals who are normally not able to prioritize their care finally can, because there's someone who's meeting them directly to talk to them about their needs.
Being that support person for them is just so rewarding to me.
Gracias que tengan ese buen corazón, valor para apoyar a las personas que más necesitamos y que sigamos. Que ya lo que va creciendo se necesitaría más después, más ayuda también.
If you're just joining us, we're talking about Vermont's migrant population with the leader of UVM Extension Migrant Health, Naomi Wolcott-McCausland. Transportation is one of the biggest issues that you face, and we've only got about a minute left, but talk to me about why transportation is so challenging for migrants in Vermont.
Only about 83% of those we work with have access to their own personal transportation. And like I had mentioned earlier, the lack of public bus systems at times of day and in routes that help people access healthcare appointments in rural areas is really challenging. So we rely heavily on volunteers to provide that support to individuals, and they are literally saving people's lives by getting them to needed healthcare.
And in the case that you don't have someone who can volunteer, you are a very well-loved Uber user.
Yes, where there are options to use Uber or even a taxi that will accept our company credit card, we often use those services to help fill the gap, to make sure that people have timely access to care instead of having to delay sometimes weeks while we find an alternate transportation option.
Well, thank you very much, Naomi. It's a big topic and we can't cover it all. Thank you very much. Congratulations on your designation as a community star. For more information about migrant health programs of UVM Extension, visit the website listed on the screen, uvm.edu/extension/agriculture/migrant health programs. That's Across the Fence for today. Thanks for everyone at WCX who made this program possible. And as always, thank you for stopping by Across the Fence.